Hello, and welcome to Chagpar MD. I'm Dr. Anise Chagpar, and I am so glad that you found this video. This week, I have a very special guest. Gary Soffer is an assistant professor in pediatrics, and he's the director of the Integrative Medicine program at Yale Cancer Center. Now, all of you have been asking me about integrative medicine or complementary and alternative medicine and how we can really incorporate all of these things into our treatment, especially for cancer, but even for other things. And I thought there was no better person to turn to than the expert himself, Dr. Soffer. So without further ado, good afternoon. Welcome to Chagpar MD.
Thank you. Thanks for having me.
So Gary, maybe we can start off by you telling us a little bit about what exactly is integrative medicine. Because I think, the term is thrown around a lot. We talk about complementary medicine, alternative medicine, integrative medicine, functional medicine. Like, what are all of these things? Are they the same thing? Are they different? And what do they encompass?
So they're definitely, they're definitely separate things, but they're similar. But integrative medicine sort of encompasses it all. The people I have the toughest time explaining it to is probably physicians, and the people I probably have the easiest time explaining it to are just people in the community who are like, this is so exciting. This is what medicine needs right now. Looking at things holistically, cancer is about a lot of things that just aren't the tumor, that just aren't either the change in your cells. There's a spiritual component, there's a lifestyle component, there's a familial component. And in integrative medicine, we try to think about really all of this and bring it all together. So integrative medicine includes complementary and alternative medicine. It also includes just conventional medicine like chemotherapy, and it brings it all together in a way that we feel like serves the patient as best as we can to both change their disease trajectory, but more importantly, let them cope and change the experience of the disease as well.
There's so much in what you just said that I'd like to unpack. So, you started with saying, this is about the whole experience. And I love that concept because anybody who's been on the receiving end of cancer, and I haven't been there personally, but I live vicariously through my patients, you realize that it really affects all of you. Mind, body, soul, family, society, financial, like it's just everything. And so this concept of somebody who can kind of address all of those issues is so critical. But you started very interestingly, I thought, talking about spirituality. So talk to us a little bit about that and what integrative medicine does in terms of that spiritual approach, because I think all of us are kind of a little bit more familiar with the complementary and alternative medicine part, and we're going to get to that. But let's talk a little bit about what you meant by spirituality.
It's no secret that we're so much more than our bodies, and we're so much more than any disease that our body might manifest. And connecting ourselves to either a higher power, whether that's, God or Allah or Buddha or Hashem, or just simply nature, and appreciating that and knowing that we're a piece of all of this and connected to all of this is so, so important. I think in our lives, we all want to feel meaningful, and we all want to feel a sense of value and importance. And by connecting with that world around us, it becomes so healing. There's a concept, and it might be a little esoteric, but I'm going to go there anyway. There's a concept that sometimes I dive into with patients, which is you can cure your cancer and still remain unhealed. And you can die from your cancer, but be healed. And spirituality plays such a deep and important role in that process.
Yeah, you know, and to our viewers, many of you know that we also do a radio show, and my show with Gary is airing in a couple of days, and I'll leave you the link in the description box below for any of you who miss it. But Gary, it brings back to mind something that we talked about in that show, which was how patients who have cancer oftentimes go through this life transformation where they actually suck the marrow out of life. Like, you give them this terrible diagnosis, and okay, we're going to take care of the cancer part. But then they go and they say, you know what? I I took on challenges that I never could take on before. I've had patients who say, you know, I've discovered what life is really about, and these are the things that I'm now gonna do. I was always afraid to travel, and now I'm traveling the world. I was in a really bad relationship, and now I've gotten out of that relationship. Or I've really started caring more about myself. And when you talk about this concept of being more connected, whether that's, you know, a sense of gratitude, or being one with nature, or finding that central purpose in your life, it kind of brings me back to that whole concept.
Yeah, it's, I think we're nothing without our stresses in life, and we're nothing without our challenges in life. I also haven't had cancer, and I do also try to go the journey with some of my patients like you do and try to understand what they're going through. But I've certainly had my challenges, and I'm sure you have as well. And they define us, and they make us, and they present more opportunity than they take away most of the time. And if we only focus on the tumor or the disease, we're only going to focus on what detracts from us. But if we can bring in these components from integrative medicine, like mindfulness or yoga, or just spirituality and connecting with your family and your loved ones in a way that you hadn't before, all of a sudden it becomes meaningful. And so, like when I talked about before, everybody's looking to be meaningful. This might be the opportunity for you to turn on that switch.
So what do you say, Gary, to people who are kind of like, mindfulness, yoga, that's all, you know, highty flighty, you know, hippy dippy kind of stuff?
Yeah, it is. That's okay, you know. And sometimes it's just about giving those things an opportunity. You know, the truth is, though, most of the things that we're presenting are not flighty, because they're grounded in thousands and thousands of years of tradition. You know, these things aren't just something that somebody made up in a crystal shop. They're really, really well developed, well nurtured things that come from cultures that have lasted for so long and given so much to so many people.
Yeah. And the other thing, I mean, here on Chagpar MD, we're all about evidence-based health and wellness, but I have been floored with the actual scientific data evidence that backs a lot of these, especially mindfulness, and how it can have like physiologic effects on reducing stress, improving well-being. I mean,
It can change your
really.
immune system. I mean, there have been studies to show that there are changes in the immune system. So you know, we know that things like white blood cell DNA information is more well preserved in people who meditate. We know that there are epigenetic shifts, meaning changes to the things that control your genes, in patients who meditate. So yeah, there's real physiological things happening. And, you know, sometimes it is about the evidence, and I am 100% evidence-based, but I also ask myself, is it a burden to the patient? Is it safe, right? So I think Reiki is the best example for all of this, because if you go through all the Reiki literature, it's mixed at best. Some of it just says it doesn't work. Some of it says it may work a little bit, but but if you talk to patients, if you interact with the patients, it's meaningful, and they've had a good experience with it, and it's changed how they felt. And that's not a burden to the patient, and it's safe. And if it's effective for them as the individual, then it's effective. You
Right.
know, I definitely apply evidence-based medicine as much as I can, But I think the problem with evidence-based medicine is we look at it as a group out of 1,000 people. How many people out of 1,000 people got better? But when you're that patient,
it's all about you.
Don't matter. Yeah, it's all about your experience. It's all about how you experience your disease.
Yeah.
And that's where integrative medicine really comes in.
Yeah. And I think that that's so true. And I think that it's not, you know, one or the other. It's not like, do I do chemotherapy or do I do Reiki, right? Like I can do them both. I can, and in truth, you know, with the literature on mindfulness, as you were talking about, with strengthening your immune system and, you know, and all of those things, I mean, that's kind of what we're going after in terms of attacking cancer anyways. So
well, I always say
not?
if mindfulness came in a pill, every doctor would prescribe it.
Right. Which brings me to another thing that should come in a pill, but that doesn't, which is exercise. And so, how does that fit in?
Exercise is a huge component of what we do. And sometimes it's the first time patients are really thinking about it, and we have to meet patients where they are. Other times, you know, it sort of works the opposite, where we see patients who have taken care of themselves and have exercised their entire life, and that relationship with exercise changes because their bodies just won't permit them in the same way.
Yeah.
And so we want to get our patients moving. We want to get our patients, you know, active in the best way possible, because we know that just sitting still does nothing but bad things for cancer.
Right. And so the other part of integrative medicine that I think a lot of people, when they first hear the term, and certainly when I first heard the term, my brain went to kind of the complementary / alternative kinds of things, right? Acupuncture, acupressure, Ayurvedic medicine, those kinds of things. Talk to us a little bit, herbal therapies, talk to us a little bit about those. You know, what do you say to patients who come in and say, you know, I want all of these things to treat my cancer?
Yeah, so first of all, I think it's important that we sort of give an overview of what these things are a little bit.
Yeah.
And the National Institute of Health, the NIH, does a really nice job of sort of grouping them. And there's a lot of overlap between the groups, but we have like biologically or nutritionally based therapies, and that includes nutrition or vitamins or even herbs sometimes. Then we have mind-body interventions, and that includes meditation, yoga, biofeedback. There's manipulative therapy, so osteopathy, massage, which is something that we offer for our patients, and acupuncture. And then there's the energy and spiritual, which we talked about a lot before. And then there's entire systems like traditional Chinese medicine, and Ayurveda is a system in and of itself. You know, first of all, the most important thing is that when a patient comes in, we keep an open mind about it and we talk to them about it. You know, if a patient's interested in an herb, one of my bigger priorities, you know, is just making sure that it doesn't interact with the other chemotherapy or other medications they're taking. You know, patients want to feel like they have some autonomy, some control over what they're doing. And so you know, our patients are educated and the internet has so much information. And so they're curious about how they can play a role in their healthcare. And so they come to us and they ask us about all, you know, herbs, supplements, and acupuncture. And it's our job to interpret it, to see what might be of benefit to the patient and also what might be harmful to the patient.
So I think that that's such a great framework that you laid out with the NIH. So, you know, the nutritional part, the mind-body part, the energy part, the systems. You know, for people, and I agree with you completely, I think that it really is when people are reaching out to try to get these kinds of therapies, it really is this grasping at, I want to be part of a team. I want some control because maybe I feel like things are out of control. And I want to play a role. And, you know, frequently we get asked, what did I eat? What can I eat? What shouldn't I eat? I want to be part of that. But I think that the other thing is that while people are kind of grasping at all of this, because you're right, there's so much information and misinformation on the internet, how do you kind of help people to figure out what might be best for them, whether it's to try to, you know, help shrink their cancer, or whether it's to combat some side effects? If people just come and say, look, I don't like the fact that I have cancer, and I feel like I'm losing control here, and I want to do something, how do you kind of walk them through that process?
So it's important to meet patients where they are. You know, for me, integrative medicine has so many tools in the toolbox. So under each of those categories, just so many different things. So I say nutrition, but nutrition's a massive, massive category. Or I say mind-body therapies, that's a massive, massive category. And so if somebody has a tradition that's rooted in something like Ayurveda, yoga and pranayama breathing, and those sorts of techniques, that may connect to who they are. But if they're Catholic, that may not connect to who they are. And so for a patient like that, you know, we'll talk about somebody like Thomas Merton, who, you know, focused on contemplation in Catholicism. So, you know, it's all about meeting patients where they are, seeing what their interest is, and then making the patient understand that integrative medicine takes work on their part, you know, that there has to be buy-in from them. And so for certain patients, that might just be putting some broccoli on the plate. But for other patients, it may be about going to, you know, an absolute plant-based diet. Everybody's going to be different, and we have so many tools available to us through so many different fields in integrative medicine that every patient ends up with something different.
Are there certain techniques that are better for certain side effects than others? So for example, if people are going through chemotherapy and they're having terrible diarrhea, or people are having terrible nausea, and they come to you and they say, listen, I don't want to take yet another medication. What can I do? Are there certain things that work better for people who have particular side effects than others?
Sure. So we definitely have certain tools in our toolbox that work for different patients. So with nausea, sometimes that's about herbs, and, you know, ginger has always been a great herb for me to prescribe patients in the case of nausea. In the case of neuropathy, it might be patients who want to do yoga, you know, and we offer chair yoga and internet classes and those sorts of things. Or it may be about sending them out to meet with one of the acupuncture practitioners. But again, that may not be for everybody. And so we sort of seek out what's going on with the patient.
Yeah, it sounds like integrative medicine, like all medicine these days, especially when it comes to cancer, is really about personalizing it, and personalizing it to the patient, personalizing it to where they are, what their symptoms are, what their cancer is. Tell me more about, you know, one of the criticisms of integrative medicine is research and data. And I think this is where, you know, when we started this conversation, you said one of the hardest people to talk to about this is physicians, because we're data wonks, and but physician too. But you know, a lot of times we have this perception that there is a lack of data or a lack of standardization, particularly for some of the herbal supplements and so on. So talk to us a little bit about where the research is, where the research is strongest, and where, you know, you might want to kind of be a little bit hesitant about the research.
Sure. So I think it's always important to understand how research and presentation of research works. And when you're reading something and when you're examining something, first of all, you have to check the source. So if somebody's telling you they're an authority on something like cancer, integrative medicine, make sure you're checking their background. Make sure you know who they are and what their training is in this field. You know, that's so important. The second thing to understand is how research is applied. Unfortunately, sometimes in integrative medicine, research is applied in an inappropriate manner. And I mean that they take studies that are done in petri dishes or on mice, and they extrapolate that to human beings. And Anise, you know as well as I do, if we did that for cancer, we would have had the cure for cancer 20 years ago.
Yeah.
You know, it just doesn't work that way. So the data is the struggle. And the biggest issues with data are, first, there's an absolute lack of funding, right? That falls on us as a medical community, that we're not funding this. The NIH does fund it a little bit, but really where most research dollars come, unfortunately, in this country, are from corporations. So there's not a lot of funding. There's not a lot of support at academic institutions for these things. I'm so fortunate to be at Yale, because Yale has opened their arms to this, and they've welcomed it, and they've focused on it, and they see it as a priority. But other institutions don't feel that way about it. You know, there's another issue of, you know, there's so much difference. You know, you touched upon the fact that every herbal supplement is different, and it's very tough to understand what's standardized and what's not. You know, this is where we step in, because there are certain ones that we feel more comfortable with and that we can recommend for patients. But even across studies, there's different milligrams, there's different preparations, there's different placebo, which touches upon the next point, which is placebo. You know, placebo controlled trials are the highest level of trials in medicine. And it's problematic in integrative medicine, because it's easy to give a pill placebo. I can give you a red pill that has the medicine, or I could give you a red pill that doesn't have the medicine. But it's really hard to do a placebo for meditation. And it's really, you know, you can't.
Yeah.
You can't. So that's another issue with it.
Yeah, but no, please go ahead.
No. You, I think I went through enough issues.
No, I think that that's so apropos. And yet, despite, you know, all of the issues around the data, it seems to me that integrative medicine is really becoming more and more popular. And I think that that's why places like Yale are really embracing it. It's because patients are coming and saying, this is what I want. I want a holistic approach to my care.
Mm-hmm. I want a natural approach to my care, you know, and there's a tendency in conventional medicine to believe that patients are seeking something else. They're not. They're just seeking something more.
Yeah. And I think that that's so critical. And to all of the patients out there, you should know that there are resources available to you where you can learn more, right? So Gary, what are some of the resources? If our viewers want to get more information on integrative medicine and can't come and see you here at Yale, because our viewership is international, where do people go to get more information? Where do they find those qualified sources? What should they do if they want to add some of these holistic elements to their care? And we're not talking about, you know, taking on therapies that are completely unproven instead of, you know, tried and true standard of care therapies for your cancer, because we've all seen outcomes from that which are not optimal. But we are talking about, where can people get, you know, that information where they can really empower themselves to add to those therapies, maybe help some of their symptoms, and go to people who are really qualified. Where do people get more information?
So there are resources that I use, and there are resources that I like. So at Yale, we have a video archive that offers lots of classes on meditation and yoga and acupressure.
Is that available online?
It's available online, and it's available to everybody.
So we will leave the link to that in the description box below. Okay, what else?
So, you know, there's a great website if you're curious about herbs and you want to talk to your oncologist about it. It's always important to talk to your oncologist about it. But Memorial Sloan Kettering has put together a website called About Herbs.
Okay.
that really reviews the herbs very nicely. That's a great resource. And then, outside of the medical world, there's talking to your chaplains, talking to your rabbis, talking to people who brought you to certain places at certain points in your life where you had challenges, who were able to get you through those challenges. Another great resource, before I forget, is University of Arizona happens to have a very robust integrative medicine program, and they happen to have quite a bit of resources online as well.
Terrific. Well, we're going to link to all of those in the description box below. And again, to all of you, we hope that this video has been helpful. We hope that you've learned a lot about integrative medicine. And remember that, as Dr. Soffer says, you really need to meet yourself where you are. And whether that is talking to your chaplain or going for a walk or seeking out resources on herbs or simply talking to your best friend and, giving your kids a hug, it's important that you take care of you. So I hope that this has been helpful. I hope that you will like and share it. Please do send this on to people that you think might enjoy it. I will leave you a link to our podcast, which I hope you'll catch on Yale Cancer Answers, in the description box below. Please do subscribe. As always, we love hearing your comments, so leave that in the comment box. And until next week, I'm Dr. Anise Chagpar, wishing you all a safe and healthy week.